As inclusion is extended in well-being frameworks that depend on shoppers to pick healthcare coverage designs that best address their issues, interest in whether buyers have adequate comprehension of healthcare coverage to pursue great inclusion. The new IJHPR article by Green and Partners, looking at comprehension of beneficial healthcare coverage, SHI, among Israeli buyers, gives a significant and convenient solution to the above question. For sure, their review resolves comparable issues to the ones recognized in the U.S. medical care market, with two eminent discoveries. To begin with, they show that by and large, paying little mind to segment factors, there are low degrees of information about SHI, which the writing has come to allude to all the more comprehensively as healthcare coverage proficiency. Second, they find a huge dissimilarity in healthcare coverage education between various SCS gatherings, where Jews were fundamentally more proficient about SHI contrasted with their Arab partners. The creators' discoveries are predictable with a developing collection of writing from the US also, somewhere else, including our own, giving proof that buyers battle getting it and utilizing healthcare coverage. Concentrates in the US have likewise observed that challenges are by and large more intense for populaces thought about the most helpless and subsequently most needing satisfactory and reasonable healthcare coverage inclusion. The creators' discoveries point out the need to tailor correspondence methodologies pointed toward relieving medical coverage proficiency and, eventually, access and results variations among weak populaces in Israel and somewhere else. A major policy drama is taking place in the US where the government is in the process of deciding whether to repeal and replace the ACA, better known as Obamacare. The program, among other things, offers health coverage for millions of Americans who have never held or purchased health insurance in their lives and is the reason for the historically high rates of insurance coverage in the US currently. Despite these successes in coverage expansion, many consumers, especially minorities and low SES individuals, have limited knowledge about the nature and terminology of health insurance. With growing indication that consumers are having difficulty in purchasing insurance plans that offer them adequate risk protection. Obamacare, however, is not unique in facing this problem. An earlier U.S. coverage expansion, known as Medicare Part D, which offers standalone prescription drug coverage to, mainly, older adults, has exposed similar patterns. Indeed, empirical studies and secondary data analysis have repeatedly shown that beneficiaries do not have full command of the program and often, for example, focus on premiums rather than total expected costs, leading to higher overall costs. Much of our knowledge about consumers' understanding of and decisions about health insurance is based on studies from the U.S. healthcare market. One might wonder, therefore, if these findings are solely endemic to the U.S., or whether they can be generalized to other countries and populations. At the point when there is a crisscross between medical services needs and plan decisions coming about because of chronic weakness protection proficiency, buyers might not have sufficient gamble security to cover their normal medical services needs, or they might buy superfluous inclusion. Green and Partners' significant discoveries add to a developing writing on medical coverage education, the majority of which reasons that buyers don't comprehend key healthcare coverage terms and experience issues adjusting what they need in a protection plan with what they pick. The creators' discoveries point out the need to tailor correspondence techniques pointed toward relieving medical coverage proficiency and, at last, access and results aberrations among weak populaces in Israel and somewhere else. It additionally features the significance of establishing decision conditions that work with a choice cycle, alluded to as decision design, in well-being frameworks depending on customers to settle on inclusion choices. To be sure, our own work has uncovered that members with both high and low health care coverage proficiency benefit from improving on inclusion decisions by equivalent sums. Anyway, the greatness of this impact addressed a bigger relative increment among members with lower healthcare coverage education, given the weakness with which these members came to the inclusion decision climate. Anyways, thank you for watching this video. Don't forget to like and subscribe, and see you on the next video.